We just got done. We've been at a conference, day of great scientific talks, and I'm like, well, yeah, but what do you do? And so we're just having a chat about your take on things and just how you feel about it, basically. Yeah. All right. So just want it to be, pretty relaxed and organic, and we'll go from there.
All right then.
Good?
Yeah.
Okay, I think we're on. And I think the audio is good. Almost too good. All right. So today I am sitting down with Rudolf Guilbaud, Director of Chromatography with Bioanalytical Services at Celerion. Rudolf has decades of experience in bioanalysis and chromatography, and what makes this conversation especially interesting is that he returned to Celerion after more than 15 years when we were MDS. And so I wanted to talk with him about that journey, what drew him back, and what is meaningful for him. So Rudolf, you started part of your career here years ago, then returned after a long time away. What made you decide to come back now?
Essentially, to be honest, I spent 16 years at MDS, and I would have still been here. The reason was it was changing country, and at the time it wasn't a good timing for me. My wife and my kid were not too keen about that, and so that's why I didn't make it before. Otherwise, I probably would have been there, either here at Lincoln or maybe even in Zurich. But it turned out I stayed in Montreal, moved on to do something very similar but large molecular analysis, which actually would be something that we could eventually implement at Celerion. And therefore, now my son is an adult, my wife is on board, so we decided it's time to move on, and I'm really glad to be here, because over the years I work with several people in the company in different groups: method development, quality, instrumentation, some director of the lab at the time, and I felt really welcome. And I'm also very familiar with the procedure because I contributed to put some in place before I left the company, because I had a position of operational quality director. So I was the liaison between Zurich, Montreal, and Lincoln at the time, and collaborated with all the sites. So some procedures are still there, and they're working very well. What changed? People didn't change, because, and that's one of the strengths of Celerion, because many people have been there for decades and they still like the company, and that's the wealth of knowledge. It's still there. What changed for me, it's essentially, I was really impressed by the level of automation in the lab, and the way the electronic lab notebook worked. For me, it was a big change, and I was really impressed, and I'm looking forward to continue working with the team.
Awesome, awesome. I'm going to make a tiny little tweak. Your collar underneath your, yeah, there you go, just so that's evened up. Perfect, great. So, no, it's fantastic, and it's a great story. Thanks for sharing kind of that journey with me.
Thank you. That's cool. Actually, when people ask me about it, I say, well, I would have been there much faster if it wasn't the timing, right? And
it's all about
because in up to 2010, I traveled maybe 2-3 times to Lincoln, and it was like, okay, but we had to move on at one point. Family, happy wife, happy life, as they say. So all is good now. Ready for the new challenge.
Excellent. Well, we're glad you're here.
Yeah.
For sure. What's important to you in your life that directly or indirectly connects with the work that you do?
I went into science because I wanted to contribute to improve, the well-being of, the people, or contribute in some way. And when I studied in life sciences, I first studied in environmental sciences, and then I switched to health sciences. And really, I say I'm not going to change. I really like what I was doing, because contributing, we all have people or friends that are affected by disease, and one thing that resonates a lot with me is when you discuss with people and they share their story about the disease they have and the medication they take, and I realize, oh, I contributed to put that drug on the market. And I don't mention it to them, but for me internally, it's well, I'm glad I was able to make a difference in the life and well-being of certain people. And so that's what keeps me motivated. We went through a lot of challenges, sometimes to put those drugs on the market, but it was really worth it when you have that conversation with people.
Excellent, excellent. And you've seen bioanalysis from many angles, right, across your career. What do you think really matters most when it comes to delivering reliable data?
Reliable data, you need a combination of very strong processes, integrity, and quality. I can give you an example. Sometimes it's important to focus on details because everything can work very well. You have everything you put in place and realize that, oh, the study, there was an issue with it. I'll give you an example. I came across studies where the validation and multiple sample analysis went really well. The success rate was over 90%, nothing to say, very clean study. And so everybody, let's move on. But there was one detail, and they didn't pay attention to, because when they were comparing the concentration obtained in the study sample, it was a drug and a metabolite. One of the metabolite was really about 10 times more than what was obtained in the literature. So that was kind of overlooked because, well, there's no flag. Everything went well, QC passes, calibration curve. And it turned out that after we did a root cause investigation, we noticed that there was an intermediate metabolite that was present in the study sample. And during the extraction process, there was an introduction of what we call a methyl esterification that caused the conversion of that metabolite that actually wasn't present in calibration curve and QC. It was only study sample, and it turned out that it increased the concentration of the other metabolite by a factor of 10. So obviously the data wasn't reliable, and the study, after we did the investigation, the study had to be repeated. And lesson learned, you need to pay attention to any tiny detail, even if everything looks good. And one other example I can relate to, sometimes we say, oh, the validation passes. If it's borderline, you better look into it. Maybe add an additional precision and accuracy to make sure, oh, it wasn't a fluke, because you got 14% and the criteria is 15%. No, look into that, dig further. My former supervisor used a lot of an analogy that's the Swiss cheese model. She used to tell me, and I use it up to that day, it's like a Swiss cheese. You have multiple layers, and in each layer, which is a line of defense, you have holes. So those are imperfection, right? And it could be human error, it could be system malfunction. But if you put a multiple layer and stack them on top of each other, the mistake won't go through completely because you have multiple layers. So the idea is to put robust processes in place, and therefore also quality and integrity is the key word there, because people need to be accountable and make sure they follow the SOP. And we try most of the time to meet the criteria in the guidance, but exceed it also to close all possible loops.
Yeah, no, it's a fantastic goal to have, and I appreciate that, the Swiss cheese analogy. That's an interesting and fun way to think about it. So, Rudolph, for someone outside of biotech, how would you explain what chromatography enables in drug development, and why is it so critical?
Well, chromatography plays a critical role in drug development because it allows you to separate, to isolate, to purify compound, and to do quantitation. It's used at every stage in the development process, from the discovery all the way to the production of the API. And it allows you to detect impurity. You do PK and ADME study to identify metabolite, and it allows you to separate isomers that could be very bad for the health. One example we can think of is thalidomide. So this technique is there to prevent that, and it's very powerful technique, especially when combined with mass spectrometry, because it allows you to get structural information about the compound. And all in all the way to the end, when they have to do the quality control and assess the purity, they still use chromatography to make sure that it's consistent and the purity is there, and the concentration that will be given to the subject is accurate and it's safe. So that's why chromatography is very important.
Indeed. Excellent. And from your perspective, what does strong collaboration between a sponsor and a CRO actually look like in practice?
I think a key element that comes to mind right away, it's very strong communication. That's key. We need to be proactive. We need to be responsive to our client. And that's the best way to build a great partnership. They need to be informed from the moment the study starts all the way to the end. And when issues occur, they need to be informed, because the best relationship I built with clients over the years was during difficult time, because we had challenges. We're doing science. We put processes in place, we put systems in place, but things will and can occur. So therefore, it's a matter of how do you react to that situation and to fix the issue and propose solution and come up with the best possible way of moving forward. So I think that we need to have that relationship with the client and share with them and come up with solution.
Indeed. And I think that's where trust is built, when you proactively share, okay, this didn't quite work out like we expected. Here's what we think we need to do next.
Exactly, and then you do a follow-up, we call it, after the study, you do lesson learned type of meetings to say, okay, what can we do to improve it for next time? And then you can take it from there.
Brilliant. As a leader, what type of culture do you try to build within your teams?
Once again, I think it's communication, but I'd like to build a culture of trust and have people in the team really able to express their idea, being open with them, being transparent. I'd like them to be able to participate and come up with potential resolution. Essentially, it's some type of empowerment. People need to be engaged and they can give idea, they participate to the solution. That's the way I always manage my team, and it worked very well over the years. And I'm planning to use the same approach here.
Excellent. And I think it's also, it's great in teams, but I think it's also very important in developing good science.
Yes, absolutely.
Yeah. Excellent.
And then also promoting, some learning and development. We studied science, and I'd like to see people more versatile in the work they do. But of course, it goes with number of years of experience, but we want to put together some session where we will share the science, new product on the market, new technology, so that everybody can be informed and can be motivated for everyone in the team as well.
Yeah, we have to keep up. Technology is moving at breakneck speed, and
absolutely,
yeah. If you don't follow what's happening and try to stay up with the latest technologies, somebody else is. You're going to be left behind.
Yeah.
Excellent. What excites you about this next chapter, especially being back at Solarion?
This next chapter, essentially, the first thing I'd like to do is build a strong relationship with my team. You as good as your team. So the important thing is to build the relationship with the team and also with the sponsor. I'm new at Solarion. I think I'd like to build a relationship with the sponsor and the team. And the second thing I'd like to do is essentially, we have strong processes in place. Automation is very strong here. I'd like to look at some of the procedure and look for low-hanging fruit with small adjustment we can do to improve, I would say, the process. I mean, sometimes it's just taking a streamlining. You get the same result and you have all the control in place, but it can help get some improvement over the years. I have a few examples. I don't have to share them right now, but I'm already thinking about them.
Good.
And the third one, essentially, I'd like to focus on new technologies. And we're actually going to be acquiring 7500, which is the new instrument from SciEx. It's very sensitive. We have a great fleet of instruments right now, but this is the new one on the market. And maybe focus a bit on doing some hybrid LCMS type of assay. There's a high demand for large molecule. We're a small molecule lab in chromatography, but we have a great team in doing large molecules. So if we can combine the power of doing the immunoaffinity enrichment, because that's often the reason why the large molecule are analyzed, it's because it's more sensitive. But if we're able to do the immunoaffinity enrichment and combine it with the mass spec, which is more specific, therefore we have a very powerful technique, and it will allow us to get more information about the drug on the market also. So this is one of the areas I'd like to start focusing over the next years.
Excellent. Excellent. I know it's exciting to get the 7500s in-house. It's a big investment, not just the capital investment in the instrument itself, but it's a new software, new procedures, new validation that's going to be a little bit more complex this time.
Absolutely, and we were just having that discussion earlier today because we have our colleagues in Zurich. They already have the instrument, but they're struggling with the software. Actually, SciX, there's a lot of moving parts because it's not only the operating system, which is SciX OS. They just upgraded it. It's going from 3.4 now 3.9, and they're going to issue 4.0. So you need to validate the system before using it also. So you need to validate. And then there's Windows 11 component coming into play. So those have to be aligned. Otherwise, you're going to validate 3.9 and version Windows 10, and then you're going to have to revalidate version 4.0 and Windows 11. So
no point in duplicating work.
No, don't want to do that. But in the meantime, maybe we can do asset transfer in a sense, getting the R&D and method development to get used with the platform, optimize some of the assets, and then when the validation is ready, then we would be. It's a matter of getting the instrument working. But it seems that the OS, SciX OS, is really streamlined the process. But we haven't started using it. But that's the feedback I'm getting from other colleagues in the industry.
Excellent, excellent. Well, Rudolph, we're really excited that you're back working with us. I'm excited to work with you directly. Thanks for sharing your unique perspective and for really talking so openly about what brought you back, what plans you have to improve processes, to work well with the teams here, and continue to build a great culture here at Solarion. Appreciate the depth of experience and thoughtfulness that you bring to the work.
Thank you very much. That was a pleasure discussing with you.
Awesome. Great.
Great.
Yeah.
Thank you. I was
Perfect.
so stressed.
Yeah. No. Yeah. It's hard when you're kind of thrust in front of